And how can people, if they're not having symptoms, and they've been exposed to spike protein, and what can they do in their daily life to protect themselves and prevent any kind of flares?
First of all, I recommend that everyone in the country gets a troponin and a D-dimer test. You need to know and be sure and be comfortable that those are normal or within the normal range. Also, it's something to compare to in the future. If you start getting sick in some ill-defined way, is this something else? Or do I get a new COVID? Did I get a spike protein exposure? Then you repeat those tests and differentiate between something simple and self-limited and something that could be dire. So everybody needs those tests. We have a lot of incredibly arrogant doctors who won't even honor their patients' request to do the tests, but they have laboratories where you can do it on your own. They have, I think, a healthlabs.com. They have Life Extension Foundation, lef.org. These are all places where people can go on and sift through it, order those tests on their own, and know for sure whether they might have something going on that they don't know about. Even more so, let's say somebody says, well, that's crazy. That's just being too cautious. Well, then let's ratchet it up one step. If you have any symptomatology at all, if you start having a little stabbing pain in your chest that you never had before, then you damn well better check these things, or you're inviting a great deal of tragedy, because even though we are seeing difficulty resolving the spike protein, when you can knock down its active presence and bring things to an asymptomatic state and bring blood work into the normal range, you can obviously still achieve a lot, contribute to the longevity and the quality of the life of that patient. But the other thing is, let's say, flip it around. The D-dimer is a little bit elevated, the troponin is a little bit elevated. Well, you need to see a doctor first that knows what the heck he or she is doing, which rules out the mainstream completely. So you need to see an integrative doc, somebody like that along these lines, someone like yourself, that appreciates that something like that needs to be treated. The cortisol and the vitamin C is very effective at that. The methylene blue is very effective at that. And also at that point, before somebody like that gets declared resolved, I'm not going to necessarily use the word cured because of what we said about the protein, the spike protein, but gets resolved, then they need to get a stress test, an exercise stress test, and they need to get a prolonged, probably not a 24, but a 48 to 72 hour Holter monitor test to make sure there's no background arrhythmias that are coming to play that need to be treated or periodically checked on. A lot of these folks that have any degree of heart problem at all have developed something called postural orthostatic tachycardia syndrome, POTS syndrome, which in a nutshell means if you're just sitting down there comfortably and your heart rate is 75 and you walk across the room, the heart rate's 130. Okay, so that needs to be determined that you're not prone to that and that your stress test response of heart rate is normal and resolves normally. So there's a lot of different ways to validate that. And of course, with the elevated troponin, even if a tiny bit, most people, if they can afford it, okay, there's so many things based on economy, right? If they can afford it, they need to get the CT scan of the myocardium with what's called late gadolinium enhancement, which specifically then lights up any remaining inflamed areas of the heart. And it's important to know. It's important to know if you're dealing with something that has resolved, or whether you're just going to accept that it's now at a low grade level and you need to be more watchful and in tune with any future symptomatology or events so that you can treat them more readily. I mean, I think most people, if you want to keep it simple, will do very well if they can just get access to 50, 75 gram infusions of vitamin C. They'll do great. Okay. And in fact, that's probably one of the biggest benefits of the pandemic that I've seen is there's more people around the world now that know about vitamin C and use it regularly than ever before. So that's a true golden lining. Same thing with the peroxide nebulization. And the really most important thing about the pandemic is that so many people now, even though they don't want to believe it, realize what a fraud modern medicine is, and realize that majority of doctors do not put the health care of their patients as their number one concern. And then take it a step further, the mainstream doctors that actively suppress other remedies like vitamin C, et cetera, in the intensive care unit for septic shock, those doctors need to be incarcerated and go to jail for negligent manslaughter.